Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and we're so excited to have you with us. I hope you're having a great day. I hope your family's healthy and happy. And we are so thrilled today. I'm going to be doing a special presentation on some of the things you should know that I believe is important for everybody to know. In a world where we are told the number one, two, three causes of death in America always seem to include heart disease, strokes, heart attacks. I thought it was time we put together a presentation on what you should know about cholesterol and cholesterol lowering drugs. And then what are some of the natural solutions, antidotes that science has already figured out in medicine and medical journals already know about the truth about cholesterol lowering minerals, vitamins, and something called bioflavonoids found in fruits and vegetables. You might as well know the truth, so we're going to share it with you here. All right, so I'm going to actually show a PowerPoint. I hope you'll follow along. And then remember, as always, this PowerPoint, all about cholesterol and cholesterol lowering drugs, the PowerPoint is converted into a PDF. It is free to download underneath the Patient Resources tab at thedrardisshow.com. So if you find this actually beneficial, go to thedrardisshow.com, forward the link, let people know, anyone you know and love that might be on these medications or have concerns about cholesterol in general. They want to know the truth and you want to share it with them, tell them to go to the Patient Resources tab at thedrardisshow.com. All right, let's dive in. Here is the truth about cholesterol and drugs by yours truly, Dr. Brian Ardis. You can scan this QR code. You actually will put in your email, and then we will notify you each week, anytime we have a new presentation, a speaking event, book signing, doesn't matter, new podcast that we've just put online. We wanted you to know, and you want to be in the know. Make sure you scan that QR code, put in your email, and you will know and be up to date on when we're producing anything. All right, per the American Heart Association, this is right off their website, we're going to define what cholesterol is. All right, so here underneath their article titled, What is Cholesterol? They state cholesterol is a waxy substance throughout the body. It's not bad, they say, unless you have too much of it. Your body needs it to build cells and make vitamins and other hormones. But too much cholesterol, they say, can pose a problem. Cholesterol comes from two sources. Your liver makes all the cholesterol you need. The remainder of the cholesterol in your body comes from foods from animals. For example, they say meat, poultry, and dairy products all contain dietary cholesterol. On the American Heart Association's website, they have this digital PDF titled Consequences of High Cholesterol. High cholesterol increases your risk of health issues like heart attack and stroke, the world's top killers, they state. If high cholesterol is left untreated, it can lead to a higher risk or complications with these scenarios: cardiovascular disease, stroke. Now, on the left on this digital PDF, you'll see what a normal artery looks like. Then you see a cholesterol-blocked artery. Let's read what they describe cardiovascular disease to be. High cholesterol is a major risk factor for atherosclerotic cardiovascular disease, which is caused by buildup in the arteries and increases the possibility of a heart disease and stroke. I think we've all heard of plaquing in the arteries. Stroke, they also say, this means there's high amounts of bad cholesterol in your blood can block a critical path in your brain by clogging up your arteries. If the buildup gets too high, it can lead to a stroke, they say. The American Heart Association also says that high cholesterol can lead to complications with diabetes. Diabetes, they say, can put a dent in your good cholesterol and increase the amount of bad cholesterol in your blood, increasing your risk of heart attack and stroke. Also, artery disease, peripheral artery disease, narrows your arteries and reduces blood away from your heart to other parts of your body. High cholesterol increases your risk of PAD, peripheral artery disease. Peripheral just means away from the body, and can also narrow critical pathways through your arteries. They also mention that if you have high cholesterol, it can make complications like high blood pressure. High blood pressure can damage your blood vessels, where the bad kind of cholesterol, LDL, can build up and narrow your arteries. Then they state, lower your cholesterol to lower your risk. And I just highlight one statement. Talk to your healthcare professional about the best treatment plan for you. Well, what do you think those treatment plans include? First, before I dive into what medical doctors are going to recommend to you, I want to take from a PowerPoint that is already online at slideserve.com what is summarized to be some of the functions of cholesterol. Now, this is just one slide from the presenter who did this, but I thought it was a very quick summary of what are the functions of cholesterol. Why did God or Mother Nature make your body make cholesterol? Number one, it is required to build and maintain cell membranes. Did you know you can't make any cells in your body? New ones, damaged, those with cancer, those that are infected. Your body always lays down new cells. Did you know your body needs cholesterol to do that? Did you know cholesterol aids in the manufacturing of bile, which helps digest fats? So you can't digest fat without cholesterol to make bile in your liver, stored in your gallbladder. Did you know that cholesterol is important for the metabolism of fat-soluble vitamins that include vitamins A, vitamins D, vitamin E, and vitamin K? Did you know you needed cholesterol to do that? Did you know that cholesterol is the major precursor for the synthesis, the manufacturing of vitamin D and of the various steroid hormones, which include cortisol, your stress hormone, aldosterone in the adrenal glands, and even your sex hormones like progesterone, estrogen, and testosterone? Did you know you needed cholesterol to even make progesterone, estrogen, and testosterone? Well, how many people do you know struggle with these hormone imbalances when in fact many of them might be on cholesterol lowering drugs or on low fat diets, lowering cholesterol production, leading to worsening hormone imbalance? I don't know if you know this. Did you know that there's a direct correlation to lowering your cholesterol and erectile dysfunction and lower sex drive? Why? Testosterone drives both, and you need cholesterol to produce it. Did you also know they have stated down here that further recent research shows that cholesterol has an important role for the brain synapses as well as in the immune system, including protecting against cancer? Well, if that's true, what do you think happens when you reduce cholesterol with statin drugs or lower the fat content in your diet? Now you're producing less cholesterol in the body and you're 20 years ago, I read a book called The Cholesterol Hoax by Dr. Sherry A. Rogers, MD. And before I even get started, any of you who are like, you know what? I'm going to listen to this, but I'd like to learn more. This is the book. Go buy the book, The Cholesterol Hoax, the summary of all the hoax and lies about cholesterol and the good and bad cholesterol. All of it is summarized by this incredible MD with incredible research. You can easily go to Amazon or anywhere online and buy The Cholesterol Hoax. In fact, you can probably buy it at half-price bookstore. All right, the Mayo Clinic defines high cholesterol, and we're just going to show you what the various forms of cholesterol are. When you look below, you'll see how they diagnose it. They'll take a blood test, check your cholesterol levels, and this is called a lipid panel or lipid profile. And when you look at your blood work, you will typically see these four indicators they're looking for to assess your cholesterol levels. You'll see a total cholesterol number on your blood work. You'll see an LDL cholesterol, which you all know is to be bad cholesterol, HDL cholesterol, that they want you to believe is good cholesterol, and triglycerides, which is a type of fat in your blood. Interpreting the numbers. I'm going to show you this because anybody out there going, I wonder if I have high cholesterol or not. I don't even know what these numbers mean. I'm just going to show you what it is the Mayo Clinic has published right now on their website are the desirable or best numbers, they say medically, for cholesterol. So first we're going to look at total cholesterol in the United States and some other countries. And what you learn at the Mayo Clinic is that they actually have different measurements for cholesterol in different countries. So we're going to focus on US and those other countries that use the same benchmarks as the United States because it's easier for reference. They state for total cholesterol that below 200 milligrams per deciliter of blood is the most desirable. If you're in Canada or most of Europe, it's below 5.2 millimoles per liter is their measurement, is what they say is the best. Now, for a lot of you, you may not know this. Did you know this number for total cholesterol to be considered good. Did you know that when cholesterol drugs first came out, that the desirable number was less than 300? Do you know that over the last 30 years, they keep dropping this number lower and lower and lower? And do you know what that does? It lets them prescribe more cholesterol busting drugs. We're going to continue with interpreting the numbers. Total cholesterol we already looked at. This is LDL cholesterol that you will see on your blood report. And I just want you to see, the very first one is below 70 milligrams per deciliter. They recommend this is the number best for people who have coronary artery disease, including a history of heart attacks, chest pain, stents, or coronaries bypass. Below 100 milligrams per deciliter is what they say is optimal for people at risk of coronary artery disease or have diabetes. And you'll just see the rest of the numbers for LDL. The higher it goes, the worse they say it is. Now, HDL cholesterol is what they call good cholesterol. LDL is what they like to reference as bad cholesterol. HDL cholesterol in the United States and those countries using the same milligrams per deciliter, they tell you the better number is anywhere between 40 and 59 on your blood work. Milligrams per deciliter for men is better. For women, it's 50 to 59 milligrams per deciliter. But the best, they say, sorry, I didn't highlight that correctly. The best is actually 60 milligrams per deciliter and above. When you get to triglycerides, triglycerides are fats in the blood. They show you here that the most desirable is below 150 milligrams per deciliter. So these are just the references on your blood work. When it comes to treatment, I want to highlight what they state under treatment. They state lifestyle changes, such as exercising and eating a healthy diet, are the first line of defense against high cholesterol. Okay, I just want y'all to think for a minute. How many people do you know have gone to the medical doctor, they took their blood work, looked at you, and then gave you a booklet with exercising or exercises describing how to lower your cholesterol? Or gave you a booklet that included the foods you should be eating and the foods you should be avoiding to lower your cholesterol? Because what the Mayo Clinic says is lifestyle changes, such as exercising and eating a healthy diet, are the first line of defense against high cholesterol. I just want you to know, I have interviewed thousands of MDs around the world, tens of thousands of patients around the world. None of them were given exercises to lower cholesterol, nor were they given dietary recommendations to reverse cholesterol. In fact, they were only given what you see on the screen, a drug. But Mayo Clinic says if you've made these important lifestyle changes and your cholesterol levels remain high, your doctor might recommend medication. Of course they might. Statins they list. Statins block a substance in your liver needed to make cholesterol. This causes your liver to remove cholesterol from your blood. Choices of statin drugs include atorvastatin, which is the generic name for Lipitor, fluvastatin, which is the generic name for Lescal, lovastatin, which is the brand name Altoprev, pitavastatin, which is Livalo, pravastatin, which is Pravachol, rosuvastatin, which is Crestor, and simvastatin, which you all know as Zocor. These are some other medications they prescribe, medical doctors will, for high cholesterol. I am not going to read these paragraphs. I'm not even going to describe them. But I did want to make sure you saw these because some of you might know are on these. Cholesterol absorption inhibitors is another drug often prescribed for high cholesterol. Bempedoic acid is another type of drug. Bile acid binding resins is another prescription medication given to lower cholesterol. And then another form of drug for cholesterol lowering is PCSK9 inhibitors. I would like to read to you the last statement summarizing what these medications are. They are injected under the skin every few weeks and are expensive. That's all you got to know about the PCSK9 inhibitors. Then we go to medications for high triglycerides. These include what are called fibrates, niacin, which is vitamin B3, by the way, and then omega-3 fatty acid supplements. Did you know if you have high triglycerides that niacin, a B vitamin, and omega-3 fatty acid supplements can lower high triglycerides? And were you recommended those by your medical professional? This is the Cleveland Clinic. Anti-hyperlipidemic. Now, anti means opposite of, hyperlipid means high blood fat. So this is high cholesterol lowering efforts. What are, per the Cleveland Clinic, what are anti-hyperlipid, high amounts of fats in the blood drugs? Anti-hyperlipidemic drugs are medicines that help you lower your cholesterol levels. Many people have high cholesterol because of, they state, a lack of exercise, a genetic issue, or they're eating a whole bunch of saturated fat and foods and fried foods. What drugs are anti-hyperlipidemic, says the Cleveland Clinic? Those include statins, like I just mentioned, which include Lipitor, Crestor, Zocor, and others. PCSK9 that I just showed you, inject every couple of weeks and are very expensive. Fibric acid derivatives or fibrates. You'll see Tricor, Lopid, Antara, and others. Bile acid or bile acid resins. You'll see the names of them there. Nicotinic acid or niacin, called Niacor or Niaspan. Selective cholesterol absorption inhibitors like Zetia and Nexflix. No, just kidding. Nexlizet. And then omega-3 fatty acids and fatty acid esters. Lovaza, Epinova. And then adenosine triphosphate, ATP, citrate lyase inhibitors like Nexlizet and Nexletol. How common are these medications? Anti-hyperlipidemic medications are very common, especially statins. Tens of millions of people have taken statins since the first one went on the market in 1987. How do these drugs reduce cholesterol? Well, they're different and they work in different ways. Number one, they keep your liver from accessing something it's used to make cholesterol. That's what statins do. They stop your body from absorbing cholesterol. They slow down or reduce cholesterol production, or they help your liver break down cholesterol, or they help your body make more of the good cholesterol called HDL cholesterol. Now let's dive into the truth about these anti-hyperlipidemic drugs, which are cholesterol-lowering drugs. We already highlighted what are the different types of cholesterol-lowering drugs, but the three most prescribed are the three you see underlined: statins, PCSK9 inhibitors, and fibrates. So let's dive into the statins first. Let's look at Lipitor. Generic name, atorvastatin. Lipitor is by far the most prescribed statin drug in the world. Did you know that it is published skin reactions can occur just from taking it? Up to 1% of all people will develop rashes, pruritus, urticaria, alopecia, loss of hair, angioedema. Angioedema, I'm not sure if you guys know this. They say it's a rare occurrence, but I'm just going to show you what it looks like. This is angioedema, swelling of the eyes, lips, face, body parts. Now we're going to look at bullous rashes, bullous dermatitis. This is what bullous rashes or bullous dermatitis looks like. I don't know why it's hung up on this, but we're going to go to gynecomastia. This is gynecomastia. Gynecomastia is a published side effect that occurs in people after the human trials are done. So if after the trials are finished and they're done collecting all the side effects, people in those trials will be followed up later. And it is reported that men on cholesterol drugs, some of them start growing breasts. I don't know if you knew this, but 10% or more of people on Lipitor will develop chronic diarrhea. In fact, the exact percentage is 14.1% of all of them. 10% of, that's a very common side effect, by the way. Another common, up to 10% of all people will develop nausea, flatulence, and constipation as a result of taking Lipitor. For the genitourinary systems, 10% of all people on Lipitor, it has been found, will have a urinary tract infection as a result of taking Lipitor. Thrombocytopenia is another side effect published of Lipitor. Don't know if you know what that is, but that's blood clots. Did you know that jaundice is a reported side effect of Lipitor? Did you know that abnormal liver enzymes on your blood work are also common side effects of Lipitor? And did you know allergic reactions, including anaphylaxis, can occur in 1 out of 10 people who are on Lipitor? This is jaundice. You'll see the yellow eyes. This is anaphylaxis. You're seeing rashes and hives all over the body.